I would like to welcome you all back to our first panel today. We're going to be talking about overcoming barriers in healthcare workforce development related to licensure and policy and regulation. So we have 4 wonderful panelists, and I'll introduce them. Kelly Jenkins, here in the blue, is the Executive Director of the Kentucky Board of Nursing. Kelly Selvage is the Executive Director of Healthcare Programs at KCTCS on the far end. Representative Kim Mosier is the Chair of our House Health Services Committee, and Representative Steve Bratcher is a member of the House Health Services Committee. So we will have lots of great opportunities to learn about policy, some of the things that we have been doing, some of the work that we're involved in now, and some of the opportunities that we see to really make improvements in our system and our structure. So Kelly J, and I'll do that Kelly S and Kelly J so that I can keep them separate. Kelly J, as a representative of the Kentucky Board of Nursing, what do you see as the most critical barriers in Kentucky's current licensure and regulatory framework that impacts nursing education and workforce development? And how can KBN and our educational institutions work together to find those solutions?
Okay. So first of all, I just want to thank you all for having me here. And I do want to do a shout out over there to my neighbors, Representative Moser and Representative Bratcher. I kind of feel like we're on different teams here. But I do want to acknowledge that because of their strength and leadership in the House, you know, we have collaborated and we have made great things. And I know Representative Moser will talk about some of the regulations and bills that she has supported, and Bratcher as well. And so I do want to recognize that we're really not working against each other over here. We work very well together, and it's very important to develop those relationships. And I think that that's one of the reasons why we do have a strong Board of Nursing and we have a strong programmatic nursing programs in Kentucky, is because we do work together. One of the biggest critical challenges that we have right now that we are facing is our program administrator turnover rate. It is 26% since January of 2024. That is alarming. And without qualified, competent faculty, we will not have successful graduates from our nursing program. So we'll be collaborating, we'll be asking and advocating, for funding for these faculty. They're kind of a unique set of group of faculty because they, because of supply and demand, can go right across the street to a hospital and make 3 times as much money as what they're making at the college or the universities right now. And I know that some of you don't want to hear that are working in the financial world of the programs, but it is what it is. And I don't want to discredit any other faculty members at your college or university, but they don't always have those options to go somewhere like our nurses do. And because of retirement, because I've had to face this with the state level employees, nurses and attorneys that I employ at the board, I've had to fight for increases because our retirement system is not the same as it used to be. Used to, you could reach out to some hospital employee nurses and say, aren't you tired of working those 12-hour shifts, those weekends, those holidays? Come work at our college, our university, be a teacher, grow our own nurses, and you're going to have this great retirement package. And you're going to have all your summers off. Well, the summers keep dwindling down. And guess what? You have a lot of homework that you take home, right, when you're teaching and your faculty. So that's going to be one of our biggest things. And right now we have a reg that says the program administrators must have a minimum of 50% dedicated to program administrator duties. Some of them, whenever we did a survey to the program administrators that have left, what they're telling us, number one, is money. Number two is they're stretched too thin. They have been asked to take over other allied health programs at their college or university, and they've been having to teach because guess what? They've got faculty shortages. So they're out there teaching plus having to do their administrative duties. So we will probably be looking at a regulation change there to make it 100% program administrator, because you've got to understand a lot of the program administrators are administering to 4 different sites. So they may have 4 programs underneath them, which that's okay if they can get all their time dealt for program administrator duties. So that's one change that we'll probably be looking at. Another thing that is always a topic is admission criteria. We have no standardized admission criteria for nursing entry in Kentucky like they do for Board of Medical Licensure, for example. So we have complaints and we have issues sometimes when nursing students get into programs, they're not successful. We have some programs who have graduation rates of 30% in Kentucky right now. Our benchmark is 60%. That's not even really a high benchmark. We made recent changes in legislation that allowed for non-academic reasons to be dropping out, not to be counted against a program. So if they say due to financial concerns or family life, work balance, whatever it is, we don't count that against them anymore. It's only true academic failure that counts against them, but we still have schools with 30% graduation rate. So what it is they're accepting anybody, and they take that money, but they don't succeed. And then tens of thousands of dollars later, the student and the parents are having to pay back for something, a degree that they never obtained. So we're going to have to be looking at that as well. So those are the two big topics for us.
Thanks. Kelly Selvage, let's talk about it from the perspective of the campuses, the colleges within the Kentucky community and technical college system. What are some of the nursing program challenges that you see them face, particularly in rural or underserved areas? And how could these processes be better improved to support those faculty and students?
Yeah, so I do want to thank Kelly Jenkins, because I think over the last few years, under her leadership, the board has been so much more open to listening to the concerns of the educational programs and really wanting to make regulatory changes that can help support our programs and our faculty and our administrators. So thank you for that. Besides just program administrator turnover and workload, our biggest issue at KCTCS, but I talked to many of our four-year nursing program representatives, and it's nursing faculty. It's that same shortage of nursing faculty, which is then increasing the workload of those nurse administrators, right? Somebody has to be in the classroom with those students or doing the duties that faculty is not there to do. It is pay. Many of our nursing faculty with advanced degrees in nursing are making less than the students that they're graduating out and putting into the workforce as a brand new RN. That's a problem. We are never going to meet the nursing workforce shortage. You can increase the enrollment pipeline all you want. We have no one to teach them. And to your point about graduation rates, we don't have the faculty to support the students to get to graduation, because our students are not the nursing students of 10 years ago or 20 years ago or even 5 years ago. They are sorely academically underprepared in every area, and nursing is a very science-heavy degree. They are not ready for the rigor of the academic program. They don't know how to study. For KCTCS specifically, we are serving students who are working adults that are coming back to better their lives, whether they're single parents or they tried educational institution earlier in their career, they didn't do well, and now they're back. Our average age of our students is in their mid-30s. They are working, they have life. They cannot, as we heard earlier, quit working to come back to nursing school. And those external pulls on them, their children, childcare, the car breaks down, they need gas, they need food. I've had students that have been living in their car coming to school, trying to get their nursing degree. All of those things will always come before studying. That bill that's due, that's what they're going to pick up an extra shift the day before their exam because they have to pay that bill. And so these are the things that our students are facing that our faculty need to be there to support them. We hear a lot about wraparound services. In nursing education, wraparound services is our nursing faculty supporting them. Whether that's that student in the office talking about the obstacle that's keeping them from passing, or or tutoring them in giving them those remediation plans. Like, it's our nursing faculty that are doing all of those things, and we don't have enough, and we do not pay them enough, and they are overworked and undervalued is how they feel, quite honestly. The Kentucky Nurses, Deans, and Directors meeting that happened 2 weeks ago today at our KCTCS campus, that was our baccalaureate and higher, as well as our associate degree nursing faculty, and that is what they say. And we will never recruit enough nursing faculty to meet the demands that is needed for new nurses if we do not meet this need. And, as we talk about other things that I think that the Board of Nursing can partner on, it's not just workloads and faculty, but it's also some of those benchmarks. And, those benchmarks that were developed we've had them for a long time. And I'm not saying that they aren't the right benchmarks, but could we look at them? Could we talk about them? Because it's a different demographic of student. And to open access, to gain more diversity in our healthcare workforce, we don't want to put up those barriers. But to meet the current benchmarks, we have to. Otherwise, our programs are in jeopardy, and admission criteria has to change and become more rigorous. And so we're kind of, our nursing education programs are in the middle of open access, increased pipelines to the workforce, but still hit these high benchmarks that have been around for a really long time. And so I think, we need to have those open discussions of, are those still attainable given the need that we have, and how do we balance that better? Because there is a very high correlation to graduation rates and NCLEX pass rates, and you have to meet both of those benchmarks, right? And so it's hard to balance, and we have to talk about how we continue to do that in the future and serve our workforce and serve our healthcare professions.
Thank you. Representative Moser, you are you're kind of a unicorn in this space because you're a nurse and your husband is a physician, and you live that life, you have seen that, you've been embedded into the medical workforce. But now you're hearing from everybody who feels passionately about their own experience. So in your role, how do you balance the need for a robust licensure and oversight with this growing demand for a healthcare workforce in Kentucky? And are you aware of any legislative things that are underway that may help that?
We are working on a lot of recognition of previous training for some of our healthcare workers, things like foreign-trained physicians who may have done their residency outside the U.S. and want to come back to practice in the U.S., and they're being asked to repeat their residency, things like that. We do work quite a lot on this issue, and I do have an interesting perspective. And I'll even go back a little bit further in my history. I am a nurse. My husband's a physician, so I've seen the recent changes. But my father was a physician as well, family physician, and so I used to go on house calls with him. And that's how old school and kind of country he was. And it was really a sweet way of delivering care to his patients. And I've seen the evolution of change in the healthcare system. It's a dramatic change. And so that was really what piqued my interest in policy. And just seeing that some of the policies that we were putting in place were interfering with our healthcare delivery system. And now, fast forward to, when I graduated from nursing school, there was actually a nursing surplus. And so that was in the mid-'80s, and there were only a couple of us who got jobs right out of nursing school in Louisville. So that was how I ended up in the NICU. And so, fast forwarding to today, when we are seeing a shortage, and there are a lot of factors, we have to look at what those factors are. And one of the initiatives that Leslie brought to me, was it last year, 2 years ago, the audit, the data collection,
Yes.
and kind of auditing who we have in the workforce, what are some of the factors that are retaining those workers, or why are some of those workers leaving? We have a significant burnout rate in our healthcare workforce. We ask our nurses and all of our ancillary personnel and physicians to do more and more with less. And we're doing things like putting things like EHR in place, mandatory EHR, where it's supposed to streamline services and help with the interconnection or the interoperability of our system. And it's just placing more of a burden on our doctors and nurses. And so we're seeing significant burnout from that standpoint, and technology, and we have the AI issue coming down the pike. And so we're constantly putting more and more on our healthcare workforce. And so I think we need to be really aware of that. We also have violence in the workplace, and that is scary to healthcare workers. Healthcare workers need to feel safe when they go to work. And so the past couple of years, we have strengthened the laws around violence in the workplace. And last year, we passed House Bill 194, which makes it a felony for anyone who perpetrates violence on a healthcare worker in any system. It was just the emergency department, and we expanded it to any healthcare facility. And so, we're unfortunately having to pay attention to some of those things too. I started talking about the foreign docs. That is a one piece that we can look at, recognizing previous training and expediting the provisional licenses that these individuals get, to bring them to Kentucky and then keep them in Kentucky. Another area that I have worked on is increasing graduate medical education slots, GME slots, and again, training physicians and even nurses if we at some point have a need for further training to keep our healthcare workforce in Kentucky. And we've done that also through the expansion of loan forgiveness programs, and that is specific to nursing as well, at physicians and nursing. We introduced House Bill 200 a couple of years ago, and passed. It's a public-private partnership to create and issue scholarships for healthcare workers. Anything that we can do to keep people in the workforce here in Kentucky is really what we're looking at. We have, I'm going to let Steve talk about a project that we're working on together, but it's a great program. We are great partners with Leslie and Dr. Thompson and CPE, and of course the Kentucky Board of Nursing. We are in constant conversation about what the needs are. So I think you're in good hands with this leadership team, and we're trying to constantly drill down on what it is that we need to be working on.
Thank you for mentioning the data statute that you brought forward last session. We had an advisory group meeting last night for the folks that are leading this work through the collaborative, and overwhelmingly they asked for that to be brought back. So we will be visiting you again to see if we can bring that forward to get and what that statute is to just get the rigor that's involved with the Kentucky Board of Nursing when they collect their licensure data is just exemplary, and we want to see that with other healthcare fields and other related service providers, so that we can really count and know how many professionals we have working in that space. And then you mentioned House Bill 200 will be recognizing all of those partnerships. We've given away almost $12 million just in the last month with that, and have more to go. We have another opportunity with that grant opportunity as well. Representative Bratcher, I have come to know you recently, and we've gotten to be friends. You are a very interesting guy because you're military. Well, yeah, interesting in a lot of ways. You're a military fella. You work for the KCTCS in the Workforce Solutions, and yet you're our representative as well. So you see things from a lot of different perspectives. So I'm interested in kind of posing that same question to you. How do you see the balance with oversight and then filling the demands? And I know you're kind of a rebel with a cause because you see a lot of the barriers and you're not hesitant to speak against those barriers. So I'd like to hear what you have to say about that.
Well, thank you. I think that, so I have a background with the military, with the Air Force, and I'm still currently serving in the Air National Guard. But I also work at Elizabethtown Community College. So I get to see from an educational perspective, also a military perspective, and then as sitting as a representative on the House Health Services Committee, that gives me a good perspective as well. So bringing all these together, it helps me, I think, be a better legislator, because as we go through and we're evaluating the nursing shortage, which we are aware of, and some of the other healthcare related fields that shortage, we don't want to erode or reduce the standards that we have for nurses. But if we're going to focus on something, we need to focus on retention and recruiting of talented people, wanting them in the field. So, but we also recognize that as a military person, I know we are starting to look at the capabilities that some of the people in the military have, and not just in the active duty military, but National Guard. You have 7,000 National Guard members in the state of Kentucky, and that doesn't include a reserve member. So 40% of our force is reserve and guard. Didn't know if you know that. But you have some talented people, and then you have some talented healthcare professionals in there. So for example, the bill that we're looking at doing, and I'm happy to have Chairwoman Mosier support me and support that bill, is the Heroes to Healers bill. So what that does is that allows someone who is a medic in the military be able to now take a test to be able to become an LPN, and then work through KCTCS to bridge that LPN to RN. So they already have that capability, and some of the medics in the military can do far more than what some of the medics in the civilian world can do. And some of those go into the nursing field, so, or surgical tech, or scrub tech. So we can take advantage of some of this prior learning they've had in the military and work through KCTCS and work through the Board of Nursing to evaluate and determine what level they're at, and then bridge them into an RN program. So I think that's a huge area that we need to focus on, is to recognize some of the talented military people that we have. And that doesn't even include retirees. So you have retirees as well that are coming out of the military that have that background, that can go through a bridge program and become talented. And it's not just for nursing. You've got technicians, dental assistants, eye technicians, or optometrist technicians. So you have a lot of different medical backgrounds in that area, that can EMT, paramedics. So I don't think, if we're going to focus on this area, and which we need to because of the shortage, we don't need to focus on eroding the requirements and the standards, but we need to focus more on who are the talented people out there. Let's recruit them and retrain them, and let's give them some credit for prior learning, some things, and some experiences that they've had. So.
It's a great answer, and I love that you mentioned Heroes to Healers, because that's something that we're really excited about from the council's perspective, with drawing in those adult learners, those folks who maybe didn't go right out of high school and enter into college, but may come to us from a non-traditional path, and our veterans are absolutely one of those folks. That really speaks to the collaborative efforts that we have done as well, because we're constantly talking. Kelly's working on that statute. Both Kellys are working on that statute. We came together to really hone down on what our military medics would need to be able to be competent as LPNs when they come into that area of practice. So I applaud that work, and we're really excited about that. Both the Kellys, I'm wondering if you could speak to some concrete steps that KCTCS and KBN have done collaboratively to address some of these faculty shortages. I mentioned something to you last night. We had a conversation last night that was very rich, that was a little controversial, related to some of the regulations that are in place during work-based learning and whether nurses could get credit for that particular part of nursing, and all of that is controlled by regulation. But the first thing Kelly Selvage says is, I need to talk to Kelly J about that. So, we know where our resources are and where our team plays. So just wondering if you all could talk a little bit about that.
Okay. So there's been a lot of discussions about increasing apprenticeship programs, which I know Joy will be talking about later today. But, when it comes to, and I'm a past nursing program administrator, I immediately go to the logistics of that, right? And there are many hospitals and different external partners, employer partners that have their own apprenticeship programs, whether they're registered or not, student nurse apprenticeship programs and things like that. And I think, from the education standpoint, a lot of times I see it as very frustrating for both our students and a lot of times our faculty that students are getting all of this great experience in a one-to-one with an RN getting paid at this facility, but we're not counting any of that work for their clinical hours. Then we turn around and we say, okay, student, now you have to go do another 120 hours or another however many hours in that rotation, maybe in that same facility, maybe with that same nurse, or not. And so it's hard on the industry, right? Because now you're paying your nurses, or you're putting the apprenticeship person with a nurse, and then we're turning around and saying, okay, now we need clinical placement for this same student in your facility. And so it's taking up vital resources, which we all know is both clinical placement as well as a clinical educator or a preceptor. But it's also hard on that student because they have this great opportunity in the facility that they're getting paid for and they're getting good experience, but now they have to balance these other clinical shifts around that. And so it's frustrating for them to understand why those can't be counted together. And so again, it's not that it can't be done. It's the problem, as many things in education and government affairs, the amount of administrative lift and paperwork to check all the boxes and cross the T's and dot the I's takes more full-time people to manage that process, both for our partners, but also on the educational side that we just don't have the resources to do. And so how do we look at regulation? How do we look at apprenticeship programs? How do we look at the nursing education, clinical site rotations, and how all of that works, and break down some of those barriers, that administrative barrier, to make the process more seamless and easy to support students? Because we all agreed, students love those one-to-one, preceptor apprenticeship, and they'll tell you, I learned so much more in that one-to-one than I did in that clinical where I was with 7 other students, and one person, and that clinical instructor doesn't even work for this facility, and so they couldn't, all of these things. How do we increase that and help support our students more? And it's just a win-win. It's a win-win for the employer that has hired this person as an apprentice, because basically you're onboarding them for a year in your facility. They're coming out much more prepared with this immersion experience. And it's helping them academically because this is now their work. Going to school is now part of their job, right? And we're not competing with whatever their other employment opportunity is. And so there are a lot of wins that I think it's worth the effort of looking at. How do we look at all of the different pieces and try to streamline it and see if it is an option in Kentucky to expand on those opportunities?
I do want to mention, though, that several years ago, because I have some former board members that served on the board with me in this room, Dina Byers, Jessica Wilson, Michelle Dickens, and they had the foresight enough that we have what's called a nurse extern program, which essentially is an apprenticeship program, just not state noticed by the state as an apprenticeship
Registered.
program. But what it is we built that program for nursing students to be employed at facilities so they can get paid for their work. Whatever they're checked off in school, they can be checked off in by an RN at that facility, and then they can do those skills that they've been. So as they progress through their nursing school, by the time they graduate, you have completed pretty much all of their orientation with the exception of medication administration. And just a few other little nuances. So that was a huge recruitment retention program that we built, and it's in our regulation, and facilities use it to the maximum. In fact, facilities tell us we can't hire anymore because we can't afford them, because they are above their FTE workload, okay? So these are extra people that are coming in and being able to help that workforce, plus they're getting that learning opportunity. So in Eastern Kentucky, one of the programs, I think it's one of yours, did a nurse extern, they called it 360. How about that? So it's a little nifty name. What is it?
Big Sandy.
Big Sandy. And so we are letting them pilot actually paying and using some of that nurse extern role as part of their clinical so that they can use it for their school curriculum. So we can carry that across the Commonwealth, and that's another thing that I'm a big proponent of. If we are doing it in Eastern Kentucky, there is no reason why we should not be offering it across the Commonwealth. We need to be more standardized. We need to have these opportunities across the Commonwealth. So I think that pilot study is going to go fine. And, the other part that we heard was from some students saying, I want to do it too, but the employers couldn't afford to do all of the students. And again, we go back to clinical placement. You do not realize how many schools, we have 100 pre-licensure programs in the state of Kentucky, and they have difficulty getting clinical placement for their students. We don't need any more programs of nursing in Kentucky. We've got to figure out a way that we can get them the clinical opportunities. We know for a fact, data showed during COVID, when our nursing students were not in-person clinical, our NCLEX pass rates went down tremendously. They did across the nation. We know nursing is not a truly virtual opportunity for somebody to go to school and become a nurse. So we have to look at all those things, and while apprenticeships are great, I'm not so sure that we have the capacity to support it in Kentucky. Because the nurse extern role, there's no extra staff that's needed to man that program. It's a simple checklist that the student's responsible for getting checked off. They take it to their employer. They verify it's been checked off. That's all it is. There's no licensure required here at the board. There's no fee that has to be paid to the board. There's nobody having to track any of these at the board.
That raises so many interesting questions, and we had a very rich discussion with the two Joys that are sitting in front of me. We had a very rich discussion last night about some of these opportunities and about ways to break down these barriers. One of the things that just keeps coming up over and over and over is the fact that nursing faculty cannot make the money that they can make out in the field. I'm interested to hear your perspective of what, if anything, we can do as far as policy or supplementation or, I don't know, different models. We talked about dual appointments last night, where industry comes along and works as a partner with the institution, the educational institution, to make this happen. Do either of you have any thoughts on that, or what the legislature may be able to do to support that process?
Well, again, I think we are really good at creating partnerships, and when you're talking about industry's involvement in some of the salary, and obviously they'll be the beneficiaries of having a more robust workforce. So perhaps there is a way to create an industry partnership to look at how our faculty are recruited and retained. So, we are the facilitators. I am very happy to work with Kelly Jenkins and all Kellys, but with the Kentucky Board of Nursing. We last year strengthened the Kentucky Board of Nursing at Kelly's direction, and we all talked about how to include more clinical folks in the board to give a good, strong picture of what's happening on the ground. And so I think that will lend a more realistic approach to what we do. And again, we take recommendations from the board when they see a problem, and we all kind of brainstorm and see how we can fix it. But I'm all about creating partnerships, especially when our hospitals and our some of our healthcare facilities are going to be the beneficiaries and the patients. And I think that we always have to remind folks when we're working on these issues that it really is about establishing and maintaining quality healthcare for our patients in Kentucky. So that would be something I'm willing to work on. I don't have any hard and fast ideas, but I think that we, when we're having these conversations with industry leaders, they probably should and could have some skin in the game.
Perfect. You want to answer or add to that?
Yeah, I mean, we can look at potential tax incentives. We can look at potential student loan repayment programs for professionals who are going into the field. There are other opportunities. I know at some of you work at a university or college, KCTCS, if you work there, your family members can take certain classes as well as you can take classes for free. So there's incentives that we can put in place that may not be too costly that we can support. But as Representative Moser stated, we are a conduit and we try to collaborate and work with, and we can't arbitrarily pass legislation and things and make things work. We have to work together with all the other organizations to try to make things happen. So, and we recognize there's a shortage, and we're doing things like House Bill 200 that pays 50% of, if you want to start a new program or expand a medical program, you can get 50% of that paid for by the state through a grant. So that's a huge program. But if you think about it, we have 16 community colleges across the state. We have additional, 7 universities, public universities, that didn't include the private ones. And so you have all these universities and colleges have a nursing program. So I started asking myself, why are we having a nursing shortage when we have this many organizations that are teaching nursing? And as I dug into this, I realized that it was clinical. So it takes a lot more time and effort and a lot more resources for somebody to go into the clinical setting than it does in the classroom. I also want to recognize that some of these other programs, you can put 50 students into an English class or a math class. But you can, in a nursing class, you're maxed at 15 students or something. I'm not sure what the max is, but it's very limited. So now you have the amount of people that are paying tuition across the person that's the instructor is limited. So these are some of the challenges that we need to look at, and potentially some of it could be computer-based learning. I don't know where we're at, but I know we don't want to reduce the amount of requirements that nurses are expected to meet. We need to maintain those requirements. One of those areas that we've looked at too is, if you look at two sessions ago, we passed a bill that had to do with certified medication aids. So in a long-term healthcare setting, you had to have a nurse give insulin injections. We know that 40 to 50% of the people that are in long-term care settings need insulin, right? So, and a nurse was required to give that insulin, which made a huge requirement for nurses. So we shifted some of that, and we increased the training requirements through KCTCS and other ways, and worked with the Board of Nursing to say, hey, can we have a Kentucky medication aid? You give insulin injections with nurse oversight. And we did that. So that responsibility kind of went away for the nurses, not the oversight, but they actually giving the insulin on a preloaded syringe. So just that's one way where we kind of shifted some of the responsibilities to another person and another talented, educated, trained person, and moved it away from the nurses, even though the nurse still had oversight.
That's a great example. We were talking about non-traditional ways to alleviate some of the duties of nursing. And so I know Carl Wilson will be giving a demonstration shortly about our Convo, which utilizes AI as a training tool to assist folks when they're learning the the interaction between a counselor and a client. So, there's opportunities there. We're looking at expansion of the role that community health workers can play in our institutions. And that's as I've learned more about that, that's just been a really critical piece in putting some of these work demands together. I'd just like to take the opportunity to thank all of our panelists and to extend an opportunity for you all, as you see these folks walking around after the panel, to ask questions or to engage with them. I know each of them personally, and they are approachable and helpful, and will be glad to help any of you all as you go. So let's give our panelists a hand.